story, but for these routine types of surgeries. Okay, so this is our demo for the cat urethral catheter. Alright, so first thing you have to do is find his little penis. He's fully sedated. That makes this fairly straightforward. So, yep, you can lean. Kristen, you can take a look. It's a pretty normal little guy. It's a little challenge to find the very end of the urethra. So now you can see all the way around. I'm going to manipulate this. You can tell it's in. And some doctors will let go of this. At this point, there's about ½ a centimeter inside the urethra, and they'll actually work inside the prepuce like this. Either way. But you have to just kind of gently go in and get to the point where you're just meeting a little resistance. We already know the size of this catheter should be appropriate for this size kitty. So he's not quite digging having this go any further. He's pretty light. Okay, so we have our sterile syringe. Yeah, he's kind of pushing this out. I don't know that we're going to get anything right now. We'll just set that aside for a second. So I can tell that he's either got a really empty bladder, which is quite possible at this time in the morning if he used his litter box. Now if he was a blocked cat and you wanted to get a sample, you would take it directly from there. Sometimes you'll remove the catheter once and express the bladder by a manual expression and get the fluid to come out the penis without the catheter in it. You replace the catheter a couple times to make sure that the urethra is clear. But then, yeah, he's really light. The urethra is sensitive to these more rigid types, so a lot of doctors will put in a red rubber tube. It's a lot more comfortable for them. It's a little harder to place. And they'll actually suture it in, and you suture it, you take the skin around the prepuce and you suture it and you tie that around your... Is that what the other little piece in there was for? Yeah, that's what that helps to do. Yeah. So I'll just gently squeeze on his bladder and see. I don't want to push this too far, but my impression is his bladder is as empty as can be. So if you get resistance or you're not getting any fluid, don't keep going because you'll actually rupture the bladder. You'll poke a hole in it. So if you want to, you can... What? Now if we had to take a sterile sample, sometimes we'll actually just keep from any suction or back pressure. And then we'll just, so you can pull that out if you like. You can just get a feel for that. Okay. So there was a kink in there. It was not a good idea to keep pushing and pushing and pushing. So the other thing I want you to practice, you can see if you can extend that little part of his anatomy. If you were my technician and I need you to help unblock this cat. So you're going to go in and you push backward. Backwards? Yep. And maybe try 2 fingers at once.
Do you want to just bolus him?
Yeah, you can have a bolus and then we'll take him off. How much?
Like 6 mils or something?
Of IV fluids? His pressure is up low?
No, his pressure's actually been okay.
Yeah, we'll just give him a sub-Q bolus.
Okay.
Got it to work. And then push back. There you go. Okay. And see if you can just get into the little tip. Want to try it?
Sure. I'm not left-handed, but I can try.
How many of those would you like for the bolus to be?
You might have to hold a little tighter.
So you want to stop his fluids for now?
Pretty tricky business.
Yep.
Unhook his catheter. Okay. Unhook his catheter.
Okay, so we'll stop just so we don't make him irritated.
Yep.
Because he's a willing victim for us.